Hello, I'm Dr. Joseph Lambert. I work for North Hills Family Medicine.
My name is Teresa Pugh. I'm a family practitioner with Jefferson Street Family Practice.
Hi, I'm Dr. Mark Rogers, MD, and President of Arlington Family Health.
My name is Dr. A.J. Gupta. I'm a family physician here in Austin, Texas.
The Infusion Center is something that I've used now for several years. It's been a great success for myself and for our practice.
Before we had the Infusion Center available to us, we used to have to send patients to the emergency room to receive IV fluids.
As the process of having a center evolved, it became very apparent to me that having an infusion center was one of the few win-wins in medical care.
Patients that, for example, are receiving things like IV fluids or IV antibiotics for cellulitis and dehydration, even conditions like pneumonia, diverticular disease, we've treated here in the Infusion Center.
When I see a patient and I think that they need something like an infusion, it's a great alternative.
For a family practitioner, it's easier for us to monitor them next door than it is to send them to the hospital. So we are actually able to monitor them more closely in the office than we are if we admitted them to the hospital.
Now I have a viable option for patient care, and it's a step up from what I'd in the past been able to do for the patient. And yet it saves that extra step of an emergency room visit or a hospitalization, which could be costly or expose them to extra pathogens in the hospital that they didn't need.
Instead of having to go to an emergency room where they incur a much larger waiting time, a much longer waiting time, I should say, as well as a much larger bill, they've been seeing us under the tent of the family physician's office. So our patients have been very excited and have been very appreciative of such a service.
The feedback that the patients give me about the Infusion Center has been 100% positive. They feel like that they're getting special treatment that otherwise they would not be able to receive.
Employers definitely would, I would see, be in favor of such an infusion center. In the end, the employers want to make sure that their employees get taken care of. But lost work productivity is a huge thing for employer groups. And employers knowing that these services are available are something that they would find beneficial to their employees.
In my practice, I see a lot of migraine patients, and the Infusion Center has really changed the way I've been able to treat those patients. We can give some IV magnesium, some medicine for nausea, some extra fluids, and the patient will be feeling better within a couple hours and able to return to work.
Over the course of the years, our practice has thrived, our infusion center has grown, and it's become a very popular thing with our patients, and it's really been a lot of fun. It's added a new dimension to our practice. It's been something that's been able to separate us out as well from other practices.